how are you today?
I'm doing good. How are you doing?
I'm doing good. So, my name is Alyssa Douglas, and I'm a speech language pathology graduate student. And can you go ahead and give me your full name and your date of birth?
Cameron Lumpkin, February 9th, 2001.
Awesome. All right, so let me explain what we're going to do today. So, what I'm going to do is look at your face and some of your oral structures inside your mouth and just make sure all of that is functioning properly and looks like it's okay. All right, so first I'm going to start off with some hand sanitizer. Would you like some as well?
Sure.
All right, and then I'm going to get my disinfecting wipe so that I can wipe down everything I'm going to be using just to kill off all the germs. And a flashlight. All right. Let me get my glove on. All right, are you ready to start?
Yes.
Perfect. So first I just want you to look at me straight ahead. All right, now I want you to open and close your mouth just like this. All right, can I touch your face?
Yes.
And if you'll open and close. Perfect. All right, and then I want you to open your mouth as wide as you can, just like this. And again. And one more time. All right. And then I want you to slightly open your mouth, and we're going to move our jaw to the left and to the right. It should look something like this. Perfect. Now I'm going to have you close your eyes. I'm going to touch somewhere on your face, and you tell me exactly where you felt that touch.
My left cheek.
Awesome. Okay, now if you will just lift your hair up for me, and can you raise both eyebrows? Perfect. Okay, now I want you to pucker your lips like a kissy face, like this. And then I'm going to have you retract them into a smile, so it's going to look something like this. Perfect. Now I want you to frown like maybe you're mad or upset about something. Good. Next, we're going to round our lips, kind of like we're saying, oh. Very good. All right, so now I want you to puff out your cheeks. We're going to do it just like this. And I'm going to squeeze them just a little bit. Perfect. Okay, next, I'm going to take my tongue depressor. So I'm going to put this in your mouth. I don't want you to hold it with your teeth, only your lips. And I'm going to give it a little pull. And I want you to hold it as tight as you can. Awesome. Okay, so I want you to open your mouth, and I'm going to look inside with my flashlight. Perfect. Next, I'm going to have you open your mouth, and I'm going to have you say, ah, 3 times in a row. It's going to sound just like this. Ah, ah, ah.
Ah,
Perfect. Now, can you do that one more time for me? And I'm going to look in your mouth while you do it.
Ah, ah, ah.
One more time.
Ah, ah, ah.
Perfect. Now I want you to do a cough for me just like you normally would cough. Okay, I'm going to take this tongue depressor, I'm going to drag it on the top of your mouth, and if you feel the need to gag, that's perfectly fine. If you just open up for me, I'm also going to use my flashlight. Are you okay?
Yeah, I'm fine.
Did it kind of make you gag a little bit?
Yes.
Sorry about that. Okay, now I'm going to have you stick out your tongue just normally. Alright, if you'll look this way a little bit. Perfect. Now I'm going to have you move your tongue left to right, just like this. Alright. Now we're going to move our tongue to the left and right inside of our mouth. So to each cheek, it's going to look something like this. Awesome. Now I want you to point your tongue downward, but we're going to do it inside of our mouth, so it'll look just like this. Right. Okay, now we're going to do inside of our mouth still, we're going to move our tongue up, and I want you to drag it along the roof of your mouth. I'm going to use my flashlight for this. Perfect. All right, so now I want you to bring your tongue up outside of your mouth, kind of like you're trying to touch your nose. So it's going to look just like this. All right. Okay, now I want you to point your tongue downwards towards your chin on the outside of your mouth, so it's going to look just like this. Perfect. Okay, next I'm going to take the tongue depressor, and I want you to stick out your tongue. I'm going to push against it, and I want you to push against my tongue depressor as hard as you can. Perfect. Just kidding. Okay, so next I'm going to also have my tongue depressor, and I want you to push against it again. We're going to do the right and the left. So we're going to do both sides. We can start on whichever side you like. So just stick your tongue out. All right, and I want you to push against my tongue depressor. Perfect, now the other side. Good. Okay, now I want you to put your tongue on each cheek like we did earlier, and I want you to push against each cheek as hard as you can. Okay, so now I'm going to use the tongue depressor. If you'll do the left side, sorry, the right side, and this side. Awesome. All right, so that is the end of our assessment. So I wanted to point out a couple things that I noticed. I noticed some limited range of motion in your tongue, which just means your tongue isn't moving fully how we want it to. Especially when I noticed this when I asked you to point your tongue up towards your nose on the outside of your mouth. I noticed it was more difficult for you to do that motion. So that's something I noticed, and it could or could not affect our swallowing ability. And then something else I noticed is when you open your jaw, it deviates slightly to the left, but that I don't think it deviates enough to be affecting your feeding or swallowing abilities, but we'll just keep an eye on it for the future.
Okay.
Awesome. Hi, how are you today?
I'm good. How are you?
I'm doing good. So my name is Alyssa Douglas. I'm a speech language pathology graduate student, and today I'm here to look at your swallowing. Your doctor has indicated that you're having some difficulties. So I'm just here to feel your swallow, look at your swallow, and see if we can find out where these difficulties are happening at. So can you go ahead and give me your full name and your date of birth?
Cameron Lumpkin, February 9th, 2001.
Awesome. All right, so to begin, I'm going to get some hand sanitizer. Would you like some as well?
Sure.
And then I'm going to take my disinfectant wipe and wipe down all the materials I'll be using. So my pen and the flashlight. Perfect. So first what I'm going to do is just ask a couple of background questions. So this will just help me get a more clear idea of what's happening, what's going on.
Okay.
And hopefully what's causing your difficulties. So would you say that liquids are harder for you than thicker foods?
No.
Would you say that thicker foods are more difficult than liquids
Yes.
to swallow? Okay. Do you have any issues taking medications such as pills?
Yes.
Okay. And is this like any pills or is it larger pills?
Mainly larger pills.
Do you experience any lump in your throat or pain when you swallow?
No.
After you swallow, do you experience any changes in your voice? So maybe like a wet kind of voice?
No.
Okay. Do you notice increased mucus or phlegm like build up in the back of your throat after you swallow?
No.
After you swallow, do you notice any large amounts of food still in your oral cavity?
No.
Okay. Any food at all still in your oral cavity?
No.
Do you experience any burning sensation after you eat or indigestion of any sort? Like something maybe coming back up?
No.
When you eat and drink, do you experience coughing or choking?
No.
After you eat, do you notice your nose running or anything flowing back up through your nose? So anything abnormal coming out?
No.
When you wake up, do you often have a metal taste in your mouth or the taste of acidity?
No.
Would you say that during a meal it takes you longer to eat?
Yes.
So after you swallow, do you feel like there's something back there that makes you want to clear your throat?
No.
Would you say that you have a consistently dry mouth?
No.
Okay. So, when do your swallowing problems usually occur? Is it in the afternoon? Is it in the morning? Is it in the evening?
It doesn't matter. Yeah, all day.
All day?
Anytime.
Okay. And do they usually occur during eating or after eating or when drinking?
During eating.
During eating? Okay. Do they occur during drinking as well, or is it just eating food?
Yes.
During drinking. And would you say that they occur frequently or infrequently, or do they occur all day long?
Yeah, all day long.
All day long. So do these problems occur with specific meals? So is any meal better than the other, such as breakfast, lunch, or dinner?
No.
So they're all about the same?
Yes.
So how long have you had this problem?
For about a year.
Year. So did this problem come on gradually, or was it kind of a sudden change in your swallowing?
A sudden change.
A sudden change? And would you say it changes daily, like how difficult it is for you to swallow? Is it always
Yes.
really difficult, or does it change?
No, it changes sometimes.
So it kind of fluctuates between
Yes.
okay. Are some foods easier to swallow than others?
Yes.
What kind of foods?
Is anything that can be chewed up or broken down, like a chip.
Okay, something that you can break down quite a bit.
Yeah.
Okay. What about liquids? Are those pretty easy for you, or are those difficult?
They're pretty much easy.
Okay. And what about like soft textures like yogurt, applesauce, oatmeal, things like that?
Yeah, those are easier.
Are some foods more difficult for you to swallow?
Yes.
Okay, what kind of foods?
Like steak or something that's not easily chewable.
Okay, so more chewy textures.
Yes.
So do you have a lot of problems with meats, like steak and pork chops, chicken, things like that?
Yes.
All right. So what is your normal diet looking like now? Do you pretty much eat whatever you want, or are you limited?
I pretty much eat whatever I want.
Okay.
Yeah.
So are there certain things that you definitely avoid?
Yeah, no, for sure.
Okay, what are some of those things?
Like a fatty steak or
Okay.
something like that, or I would say that's the main one that I'll avoid for sure.
Steak.
Yeah.
And would you say meats in general, or pretty much just steak?
Like if it's like a chewy meat, yeah.
Okay.
Like ground beef is typically okay.
Right. Okay. All right, so now I'm going to have you cough for me, just like a regular cough. And can you clear your throat for me like you have something stuck in the back? Okay. So next I'm going to have you say ah for as long as you can. Just give me 1 second. I'm going to time it. All right. So again, we're just going to say ah for as long as you can.
Okay.
And I'll start when you start. Okay. All right. Next, I'm going to have you hold your breath, and I'm going to also time that.
Okay.
And I'll start whenever you're ready. Just make sure don't breathe out of your nose. We're going to fully hold our breath. Awesome. Awesome. So since we finished that part, we're going to move on to our next part. And this is where I'm going to feel your throat when you swallow. I'm going to watch you swallow just to see if we're having any difficulties. So we have a variety of textures. We have a thin liquid. This is just regular water. And then we have a more creamy liquid. So this is water that I added stuff to. It's just a little bit thicker and more creamy. And then we have our puree. This is just yogurt. And our solid food right here, which is croutons. All right. So what you're going to do is, I'm going to give it to you from the spoon first. I'm going to give it to you from the edge of the cup. And then I'm going to give it to you from a straw. We'll start with the water, and then we'll move on to the more creamy liquid. And then we'll proceed on with our puree and the solid, so the yogurt and the croutons. And after every bite, after you swallow, I want you to give me a ah, and I'm going to take a look in your mouth. Okay?
Okay.
So I'm going to go ahead and sanitize again. Would you like some as well?
I'm okay.
Okay. And then I'm going to go ahead and disinfect all of our materials again, just to be sure. Flashlight. Perfect. Go ahead and put my gloves on. All right, so sometimes this can get a little messy. Would you like a napkin, just in case?
Sure.
Okay. Is it okay if I tuck it in your shirt?
Sure.
going to start off with just our regular water. I'm going to give it to you by a spoon at first, and then we'll do it from the cup, and then we'll drink it from a straw.
Okay.
Okay. Is it okay if I fill your throat?
Mm-hmm. Yes.
Okay. Awesome. Now I'm going to go ahead and take a look. If you'll tilt your head down just a little bit. Okay. Perfect. Now I'm going to let you drink from the edge of the cup. Is it okay if I fill your throat again?
Mm-hmm.
Good. I'll go ahead and take a look. Perfect. Next, we will drink from a straw. So if you'll just take one sip for me. Perfect. Let me go ahead and take a look. And can you raise your tongue? Perfect. Okay, so now we'll move on to our thick liquid. So this is just the same water, but we made it a little bit more creamy. So we'll start with the spoon. Perfect. Let me go ahead and take a look. And if you'll raise your tongue. Yep. Now we'll drink it from the cup. Are you ready?
Mm-hmm.
Okay. Good. I'll go ahead and take a look. If you'll raise your tongue. Can you tilt your head down just a little? Perfect. And we'll drink it through a straw next. If you'll just take one sip for me like we just did with the water. Good. Take a look in your mouth. And raise your tongue up. Perfect. All right, awesome. So now we'll move on to our puree. Like I said, this is just strawberry yogurt. Are you okay with that?
Yes.
Okay. Perfect. So and just remember if you'll say ah for me after you swallow. Awesome. And I will go ahead and take a look. And raise your tongue up. All right. Perfect. Now we'll move on to our solid. So I'll give you this, and do you want to eat the whole thing or?
Sure. Yeah.
Okay. look in there. And raise your tongue up for me. Tilt your head down a little bit. Raise your tongue. Perfect. Tongue down. Awesome. All right, perfect. So now what we're gonna do is I'm gonna let you go through and take a drink of everything. And so how would you normally drink out of a cup?
By the edge.
Edge of the cup? Okay, awesome. I'll let you do it just like that. And I'm gonna fill your throat as you do it. And if you'll just give me an ah right after.
Ah.
Awesome. And I'm gonna just take another look just to be sure. And raise your tongue. Okay. And then I'm gonna let you do the puree. So if you'll just take a bite like you normally would at home, and I'll fill your throat.
Ah.
Perfect. Let me take a quick look. And raise your tongue. Perfect. All right, and then here is the solid, and you can just eat it normal how you normally would at home.
Ah.
Awesome. And one more quick look. Raise your tongue up for me. All right. Perfect. Okay, awesome. Now we've completed the assessment. So you did really well with the water. You did really well with the creamy liquid. You also did really well with the yogurt and the solid. I didn't notice any significant difficulties with any of these textures. I also didn't notice any high number of swallows that you had to do to get those textures down. And I didn't notice any significant food left behind in the oral cavity after you swallowed. So that's all good news. So we did have a crouton today, which I know you said previously crunchy textures like chips and things like that, stuff that you can break down very well, is usually easier for you than other foods. And you also explained that steaks, fatty or chewy meats are more difficult, which we didn't have today. So maybe that explains why there was no difficulties noted. So I would like to go ahead and do a modified barium swallow study for you, just so we can get a more full and clear picture of our swallow mechanism and hopefully see where this is breaking down. And maybe for now just steer clear of chewy meats and anything that you notice is giving you difficulty, especially like you said, steaks, maybe any threaded meats for now, until we can get that swallow study done, just to see exactly where that breakdown is happening.
Okay.
All right, do you have any questions for me?
Nope.
Okay, awesome. Thank you.
Thank you.